Okay, so we've got effleurage, and we're going to go quite superficial, which means we can go a bit faster, and we're going to go over the back of the knee. We're looking for those gastrocnemius insertions. So we're tracing our thumbs up to the origin, not too much pressure down into the back of the knee. Try and keep that touch continuous, no taking the hand off. And then for a bit of variation, you change position, move into some petrissage. Having big hands can work as an advantage, but also it's more difficult with the fiddly areas, particularly narrow clavicles and that. But just try and get as much coverage as you can from the medial border of the tibia all the way around to the fibula, and think about what you're feeling there. So we're working over the peroneals, I can feel that bump, over the lateral head and the medial head of the gastroc, and then into soleus, just in there. We can't palpate tibialis posterior, but we know it's in there somewhere. So my favoured method is to reinforce the thumb. And you'll notice I'm slowing down, so I'm going deeper. I'm going to ease off as I get to the back of the knee. Finish the stroke, keep the touch on the way back. Yeah, we don't go deep on the way back away from the heart, but we keep the touch, and then we repeat. And you'll see I'm working my way up laterally, and then I'm going to start to move more and more medially. I can feel the gap there between the medial and lateral head of the gastrocnemius. Finish off the stroke and come back. And I keep reinforcing that thumb. It's a particularly tender area when you get into the middle of the medial and lateral heads of gastroc. How's that, Sophia?
Yeah, about 7.
7, okay. But tolerable?
Yeah.
Okay. So I always find it's quite nice to work around that calcaneus. It just feels quite nice as well. Okay, so we're interacting with all that fascia, getting that moving, working up into the Achilles, and then we can pop the knee up. Just opens up a range of different things for us to be able to do. So petrissage, combination of effleurage as well. And then we get the forearm involved. No need to be completely brutal with this, but nice and broad, relaxed hand. And then we're slowly coming down, because this is going to be deeper, finished above the knee, keep the touch, and then back up again. And we're just working from lateral to medial. So a little bit of a judder there, so a little bit tender. I'm probably going a bit too fast for the depth. Okay, so this position, what else can we do? We can do a bit of passive movement as well. And we can then combine massage and movement. So we can change position. We can maybe get the knuckles involved, nice relaxed fingers just trailing behind. And then we can do a bit of massage and movement there as well.
When you're doing the elbow, you kind of lower your head down as well, so the leg kind of came down. Is that what normal's doing?
I think that's just because of my body position, because I'm coming down quite low.
I wasn't sure if there's a reason as to what is.
I'd rather it as flexed as possible, to be honest, because the gastrocnemius is then switched off and you haven't got that rest intention. Trying to find that medial border of the tibia, not put too much pressure in, move into the soft tissue, and then if you look at my elbows, trying to pull the elbows back and use the lats rather than just using the muscles of the arm and shoulder. We can pull it back and we can get the other hand involved as well. All the way up to the Achilles, and then finishing off that calcaneal work as well, which is quite nice, isn't it, Sophia? Okay, we can work into the foot from here as well. You got tickly feet, haven't you?
Up and right.
Okay. Hold it together, yeah? Okay, so you can work up into the feet in this position, which is quite nice. Trying to put that pressure down, not too much into the calcaneus, not into that spot there where the plantar fascia attaches, but just into the bulk of the flexor tendons, just through there.
Why not into the spot where the plantar fascia attaches?
Just because it can irritate it. You don't want to get into the muscular insertion for the same reason that you don't want to get into the superior angle of the scapula, for instance, because some people feel that, they think it's a big knot, but by friction in it and everything else, you're just going to irritate it.
Okay.
So also a nice position I like to treat in is this. So you can reinforce the thumb and have someone do this on you. You'll find that you can take quite a lot of, famous last words, you can take quite a lot of pressure through that flexor hallucis longus tendon. So obviously I've just triggered a bit of pain. So I'm going to calm it down, get things nice and relaxed again. And I know how far that I can go this time before getting that pain. And the bulk of my pressure is going to come in now and ease off about now. Because we've got a fat pad, bit of a fat pad there as well. So you want to be focusing on the muscles. A bit transverse as well across the fibres. all the way to the toes. Have a little play as well. See how the foot's moving. If you're not sure where it is, just push into my hand. So dorsiflexing, we can trace that tendon all the way up and relax. So you can feel that muscle there relax once you backs off. Okay, so we're just reinforcing the thumb. We know where the muscle belly is. Is that right?
Mm-hmm.
Yeah, okay, so we can go quite deep there, which is good, and often underworked muscle, I would say, from a manual therapy perspective. Bit of transverse down into the foot, down into the ankle. Don't forget, just because there's no real muscle belly here, it doesn't mean we can't do some good work on the connective tissue as well. The medial side, I like the way this opens up the foot. So I like to use this if I'm treating plantar fascia, because we can kind of pin it down, it's fairly comfortable. You're not making them too uncomfortable how you're pressing into the foot.
Does that help then with plantar fasciitis?
Yeah, generally. Yeah. So you keep it nice and secure. Foot's not moving around too much. We can break it up with some lighter work. Bit transverse. And then don't forget to work around the joint as well. They call it joint polishing sometimes. It's just quite nice and superficial, quite quick. And then we can get into, do you remember the 3 muscles that come along here? 3 tendons? Tom, Dick and Harry, yeah. So we're going to be getting into them. Don't forget these little spaces. We just think in terms of muscle bellies quite often. Those little gaps contain tendons and connective tissue that benefit from the treatment, but also can feel quite good. Okay, and then we've got access to everything medial here as well. Okay, so last bit I'll show you then, just a quick bit of supine. So go onto your back for this video. Knees up. I don't do too much calf work or lower leg work here, but I'll show you what there is you can do. So pop your knee up for me. Okay, so we've got tib out here that we can work into. We've got the peroneals as well. I tend to work across with a broad palm. My fingers are kind of anchored into the back of the calf, and then we can push the palm through the peroneals tib out. But then also you've got posterior calf. So what you want to do is keep the foot pinned with the top of your leg, not your bum bones, that's going to hurt, but that way she's not going anywhere. And then as long as you're superficial, we can get away with coming distally for this one. So coming up, joining the fingers together, imagining those 2 heads of the gastroc and trying to go in between them. Keeping in touch on the way back up. Transverse petrissage, similar stuff to that, which we can do on the back, on the front. Bit of joint polishing for the knee as well. Week in 3. Prep. Okay.